Peptic ulcer. There is damage to the inner layer of the stomach and the first part of the duodenum. That is, there are tearing and the pore formation or the sore formation in the mucous lining of the stomach. Due to excessive production of hydrochloric acid and decreased production of mucus, which is a protective secretion for the stomach inner lining. The overstimulation of the parietal cells, which are responsible for production of the hydrochloric acid, by the action of the gastrin, which is produced by the cells in the pyloric antrum, which stimulate the parietal cell, and there is overproduction. This overproduction leads to the irritation and inflammation of the inner lining of the stomach and the duodenum, which leads to the damage and the sore formation, cracks formation, hole formation in the layers of the stomach and the first part of duodenum. Major factor is H. pylori, which is a bacteria present in the inner layer of the stomach. When there is overproduction of the H. pylori due to the overgrowth, that leads to the irritation and the inflammation of the inner surface of the stomach. It also enhances the production of the hydrochloric acid. It also reduces the action of the prostaglandin, which is a protective chemical which retard the or the check the production of the undue production of the hydrochloric acid. There is a balance in the production of the hydrochloric acid and the mucus. Hydrochloric acid is a necessary for the digestive process of the stomach, but excess of everything is bad. There is excess production of the hydrochloric acid by the action of the pylori bacteria, H. pylori bacteria, and also the action of the gastrin, that is the overactivity of the cells in the pyloric antrum. So this imbalance leads to the production of the peptic ulcer. In addition to this, ancient medicine which are used by the patient suffering from arthritis, gouty arthritis, rheumatoid arthritis, and other pains, traumatic pains. So prolonged use of these medicine, they lead to the inflammation of the inner surface of the stomach, and also they produces the overproduction of the hydrochloric acid. Other cofactors or the risk factors or aggravating factors, they are spicy foods, excess use of alcohol, tobacco smoking, prolonged use of steroids. These and the stress, depression, neurological and psychological factors. These factors, they are not directly related for the production of ulceration, but they are the cofactors. They add up in the production of the ulceration. So it is of two types: peptic ulcer, gastric ulcer, and the duodenal ulcer. Duodenal ulcer is more common as compared to the gastric ulcer. Duodenal ulcer is produced not by the direct production of the acid in the duodenum, but that is the acidity which is brought by the food mixed with the food, that when it enters in the duodenum, that acidic food that produces irritation, inflammation, and subsequent ulceration. Now, what are the symptoms by the in the peptic ulcer? There is epigastric pain, that is heartburn, irritation, belching, bloatedness, vomiting, nausea, vomiting. There is tenderness in the upper abdominal area. In advanced cases, when there is progression of the ulceration, that leads to the hematemesis, that is coffee ground vomit in the patient. Then there is terry black stool, that is melena, which leads to the loss of blood through the stool, producing the anemia and the low RBC count. So there is also loss of appetite, loss of weight in gastric ulcer. But as compared to the duodenal ulcer, there is weight gain in the duodenal ulcer because the pain of the duodenal ulcer is relieved by the intake of the eating or the food. Whereas when we eat the food, that produces irritation in the stomach and overproduction of the stomach. That produces the pain and the distress to the patient. So the gastric pain due to the gastric ulceration is produced after half an hour intake of the meal, whereas duodenal ulcer appears 2 to 3 hours after the intake of the meal. Duodenal ulcer is relieved by the intake of the meal or the eatings, whereas it is aggravated and produced in the stomach by the intake of the food. Mostly the duodenal ulcer appear in the late night. So these are the difference between the two type of the ulcers, which are grouped under the umbrella of the peptic ulcer. So these are the signs and symptoms. So now we come to the diagnosis of the peptic ulcer. That is blood test, stool test to detect the antibody of the H. pylori in the blood and presence of bacteria in the stool. Breath test, that is the intake of the radioactive carbon in the form of liquid is given to the patient. Then he breathes out into a bag. We send that bag for analysis of the gas. If there is production of the presence of the carbon dioxide, then it means that there is H. pylori presence in the stomach that convert the carbon into the carbon dioxide. So this is a breath test for detection of the presence of H. pylori. The most reliable and the most time-honored used test is endoscopy, upper endoscopy. Endoscope is a flexible tube which is passed through the throat into the stomach and the upper part of the duodenum, that is fitted with the camera and also the video. So there is direct vision of the interior of the stomach and the first part of the duodenum. We can visualize through this instrument directly location of the ulcer, size of the ulcer, type of the ulcer. We also use this, not only it is a diagnostic but therapeutic use. That is, we also perform biopsy. We take few small tissue of the suspected area to send to the laboratory for histological study under the microscope to detect whether it is precancerous or the cancerous one. So it is a chronic disease. So this chronic ulceration may lead to the gastric cancer and the duodenal or the first part of the intestine carcinoma. So this is the electronic instrument which is used prior to the medical therapy, and also it is used after the course of treatment to judge the success of the treatment. So this is a very useful test which is utilized for the detection of the ulceration or the carcinoma or the other growth in the any part of the intestine, gastrointestinal tract.